regards to stillbirth and maternal mortality?
The results are always unexpected. Whatever you find results, in my second research, the results were not compatible with the books.
Inside us, and to my mind, research is a state of mind.
So it's an event in which we have to empower people with the good standardizing mindset works.
Where do we start? Good clinical study starts with a good question. First of all, we should have in our mind what will we study. We should form good hypotheses and do good comprehensive literature review before to know what is already done in the world, what is already published, where are we now, and what can we do, where can we go further. What are the risk factors for hepatitis B infection? The risk factors, we should look back. What may cause this infection, and that would be prospective cohort or case study. Is interferon a useful therapy for hepatitis B infection? To answer this question, we will need to perform a clinical trial of this molecule and to see the outcome. Is vancomycin better than cefazidime against gram-negative organism? Again, but we should not ask ourselves very obvious question like, is smoking associated with lung cancer? Of course it is. It is already proven by hundreds of papers and scientists. We should define our objectives. It should be clear and detailed, and at the end points of our research we may have two types. It may be primary, that will answer our initial question, and it may be secondary, that will answer some associated questions that may rise up during our research. Study design. We again must ask ourselves a question, describe it, do a pre-trial, pre-research analysis. We must use resources, either retrospective or prospective, and speaking about the community, we may just observe some events, some things that are happening, or we may include into it. And in clinical trial, we allocate some subjects of our study randomly, and we expose them to something or not, and then we see what will be in the end, what would be the outcomes. And in this case, it's very important to maintain the ethical questions, because you might not put a person into the big pan with hot water and see how strong he will be screaming, and then give him some analgesics, and that would be a study that will not go, but you should try something else. So I will skip some slides because I was not really oriented to have 30 minutes, so I will maintain on the most important things only, and again you will have a chance to read this presentation at home. So the bias and the confounding factor. These are the factors that may affect the way of your research and the results you will get. Because you should always take it in mind, you should always consider the factors that may do a bias, that's the effect that may affect the design, execution, interpretation, or influence the result. Why do we need the study? I think during the talk show we already answered this question. We should do a study to develop our mind, to be a better doctor, to be a better researcher, and to be a better man, make our world a better world. So again, the four main types of observational study: cross-sectional, cohort, case control, and series of case reports. So now case selection. How do we choose the cases for our research? We should of course take the general population, and we should look on the incidence of prevalence of the cases. we should look on diagnostic criteria, and speaking about group of controls, it should be selected from the same group of population.
First of all, I'd like to appreciate you guys for being at this particular event. So my name is Ruben Gondolendi, as you say, the president of the group. So the event is tagged the Symposium 2014. So it's an event in which we help to empower people with the good standardized mindset for research. You understand? Now, if you take a good look, you will realize that last year we had a conference. That was the second annual conference.
Yeah, I was there live.
That's good. Organized by the group. So during the conference, we had hints about how the researchers were presented. They were not up to standard. They were not meeting the standard required for a standard research presentation for a standard conference. So the main aim of this conference, this gathering, the symposium, is to teach people, our members, with other people who are interested in research, how to carry out and how to report your research that you are conducting. By the special grace of God, we were able to host the first Congress, and then we hosted the second Congress. And now we are hoping to host the third Congress.
In next November?
In the November 22nd of 2014. So far, talking about diversification of the group, we have also we've diversified, you understand, because the group started as a branch only in Lugan State Medical University. But with the help of God, we were able to diversify to other universities in Ukraine. Kharkov, Simferopol, Zaporozhye, we have branch right there, functional branch. And as I'm speaking to you right now, we have a branch that's about to start operating in the next couple of weeks in Russia. In Russia, we have a branch in Russia already. Understand? They'll be functional in the next couple of weeks. So that's, for now, I can see we are moving. I can say we are moving. We are not stagnant. We are moving, and we help to get to the utmost level by God's grace. Everything you're doing, you have to involve, what the power that lies ahead of you, which is God, you understand? So with the help of God, we hope to achieve a lot. That's the first of all. And the second thing is that we hope to be receiving people from at least 16 countries for our conferences by the next 2017. Understand? And by the next 2017, we hope to have, by the special grace of God, our own office, our own standardized building that we will call ours. You understand? That we will call a building that will be tagged ISMRGU property. You understand? So we hope to achieve this hopefully by 2017.
2017. Okay. Well, thank you very much, sir.
Thank you very much.
Thank you very much, sir.
Welcome.
I'm the vice president of this group. My name is Muhammad Didat Sani. As regards to challenges, when you have a progressing program, when you're undergoing research as we do, there are a lot of challenges that come with it. And amongst, when you look at the challenges are they are in a hierarchical form. Maybe when you look at first of all at the predisposing factors of the fact that we are in a different country entirely, and then you come to the fact that we have our academics to also focus on, because we are students in research, we are not solely researchers. So that is also a challenge in trying to balance between your academic work and actually doing more to actually enhance your medical career. We do have affiliations with a number of organizations, some of which include the Ukrainian Association for the Study of Pain, which we work with closely. And we can also understand that the Ukrainian Association for the Study of Pain is a member of the International Association for the Study of Pain. So automatically we also belong to that. And other groups like the EFIC, the European unions, amongst others. I mean, it's a whole connection for all around.
Thank you very much, sir.
Thank you.